What if the key to reducing anxiety isn't in your brain, but in your gut? New research actually shows that the microbiome in your gut are directly responsible for influencing your mood. I am Dr. Munir, an ECFMG certified physician here in USA, and we will be discussing some things which we all, I'm sure, did not know before. So what is a gut-brain axis? Now, a gut-brain axis is basically the communication between the nervous system, the digestive system, and the immune system. Now, before moving on to some details, let me just tell you one thing, that in body, naturally, we have certain bacteria which are helpful for the human body. Due to any reason, if there is a disruption in the microbiota, or the beneficial bacteria that are produced in our gut, if there's any reason that is disrupting that has been directly linked with the changes in mood. And you never know, that is one of the reasons that you're actually having a lot of anxiety and depression nowadays. According to the recent research, as stated by two papers, which includes Nature 2023, certain bacteria like Faecalibacterium were found to be reduced in patients who were actually undergoing treatments for depression or who had depression. Another study, which is the Case Reports Medicine, as you can see on the screen as well, I'll be attaching the screenshots as well, in 2024, told that microbiota profile can predict the response to a lot of antidepressants that a lot of patients are taking. Now I'll be mentioning how inflammation and short-chain fatty acids and serotonin is linked with the mood regulation. So first of all, we'll be talking about inflammation. Now, a healthy microbiome of the gut is responsible for maintaining a good immune system, and on the other hand, it is also responsible for regulating the mood. Whenever there's a disruption in the microbiome and there's leakage of the inflammatory molecules outside in the bloodstream, for instance, like polysaccharides, lipopolysaccharides, these can actually lead to a systemic inflammation. When there's a systemic inflammation, there's more propensity of an individual having anxiety, depression, and even neurodegenerative diseases. Short-chain fatty acids like butyrate, acetate, and propionate, they are responsible for actually helping in keeping an intact blood-brain barrier, and also directly or indirectly that helps in the mood regulation as well. Another interesting fact is that 90% of the serotonin, which is the happy hormone, is not produced by the brain, but it is produced by the gut. Healthy bacteria in the gut, such as lactobacillus, is responsible for producing this serotonin, which helps in mood elevation and keeps our mood happy most of the times. So talking about the short-chain fatty acids, for example, like butyrate, acetate, and propionate, these are formed when the gut bacteria ferments the dairy products. Now, these are responsible for number one, reducing inflammation. Number two, they're responsible for keeping a healthy blood-brain barrier. And number three, this is responsible for actually causing in the production of neurotropic factors. Butyrate, according to the latest research, has shown a direct effect in reducing depression, or in other words, it has an antidepressant effect. I, as you can see on the screen, have attached a picture in which I have made or labeled food products which have butyrate, and by consumption of these products, we can actually have a healthy gut, and that can actually lead to us having the healthy bacteria in us as well, which eventually will lead us to having a happy mind, which means no anxiety and no depression. So disruption in the microbiome of the gut can lead to altered levels of serotonin, and low levels of serotonin means more anxiety, more depression. So as a physician, I am somebody who actually supports the fact that healthy lifestyle comes first, and then only we can actually fight against a lot of situations and conditions and diseases that we're facing on day-to-day basis. I do not by any mean I'm saying or advocating for this thing that let's just stop taking medicines and let's just only resort to the food items or improve the diet. It's basically both of these things go hand in hand. we need to eat healthy, we need to focus on what we're eating, and we need to have the medication as well, because I am a supporter of holistic patient care, and that is what I'm advocating here for today. Your gut might be the second brain, and science is catching up now. So if you are interested in actually coming across more research-hacked lifestyle tips or healthcare tips, just like, subscribe my channel. I am Dr. Munir signing off. Stay healthy and stay curious.